Hey guys, I'm Tony Tian, and if you're new to this channel, I'm second medical student at University of Taiwan. So today, what we're gonna be talking about is the respiratory system examination, and same as yesterday, I'm just gonna do a summary, running through it. So basically, we're gonna first talk about the respiratory associated symptoms. So these are symptoms that is relatively specific to your respiratory system. So these includes coughing, sputum, hemoptysis, chest pain, wheeze, and hoarseness. So some of the confusing terms may be hemoptysis, and basically that means coughing up blood. And wheezing is this unique sound, really high-pitched squeaks and whistle that is heard usually during expiration, but sometimes can be heard in inspiration as well. And then things like hoarseness, and this is usually due to inflammation of your vocal cords. So let's start from the top. So cough, when you're investigating the coughing, you want to know how frequent do they cough, how heavy do they cough, and if there's anything coming up, then there will be sputum, and the appearance of the sputum can have a whole range. It can be mucoid, purulent, purulent, serous, and rusty. So if it's mucoid, it can be either clear, gray, or white, and this can be due to COPD, which is clear and gray, or asthma, that's white. And then you have the purulent, which is the dark gray and dark yellow and gray, and this is usually due to the bronchopulmonary infection, and it should have a yellowish color, and this is usually due to the neutrophils or the eosinophils in asthma, and if it's green, that usually means there's dead neutrophils. And then you have the mucopurulent, which is the yellowish respiratory tract infection. And you have the serous, which is frothy, watery, sometimes pink, and this is usually due to the bronchoalveolar cancer, which is gives you this clear, watery kind of sputum, and pulmonary edema, which is pink and frosty. And of course, thinking of rusty, basically that's due to the lysis of the red blood cells, and this is usually due to a symptom we call the pneumococcal pneumonia. And so the frequency, quantity, when it's being produced, and also the taste and smell are all worth investigating. And when it is being produced can indicate if it's an acute condition or a chronic condition. If it's acute, it's usually a large amount throughout the day, and if it's chronic, it's usually several teaspoons in the morning, right? And hemoptysis is usually due to malignancy, infection, trauma, or bleeding. Chest pain usually due to the inflammation of the pleura. It can also come from the muscle strain from the prolonged coughing, trauma or fracture from the ribs or sternum, malignancy causing bone metastasis, and the wheeze is usually symptoms that come up with things like asthma and emphysema. So it's worth asking the patient what they think is actually precipitating the wheeze. And then you have the hoarseness, which is the inflammation of your vocal cord, but it can also be chronic tumor of vocal cord, recurrent laryngeal nerve palsy, which means paralysis. And then during the actual examination of the chest, we have 4 steps: the inspection, palpation, percussion, and auscultation. So basically, when you're inspecting, look for signs of dyspnea. If the patient is struggling breathing, so it should be very obvious if they're looking really strenuous or they're using their accessory muscles. So it should be relatively straightforward. And the pattern of breathing, are they breathing regularly? Are they having prolonged exhalation or inhalation, etc.? And the shape of the symmetry of the chest, which includes kyphosis, lordosis, scoliosis, any lesions, which may suggest a history of heart disease, cancer, pneumothorax, tuberculosis, etc. And then you can have chest deformation, things like pectus excavatum, basically means there's a conic section in your sternum, and basically excavate is like taking something out. So excavatum, it's like there's a hollow thing in the middle, and then you have the pectus caranatum, which is so carinate. Basically, it's like the pigeon chest. So caranatum just means pigeon chest, like literally pigeon chest, and basically you have a protrusion at your sternum, and then you have the hyperinflation. For the pectus caranatum is the outward bowing of both the sternum and the costal cartilage, and this is usually associated with the chronic respiratory illness in childhood. And the first one, the excavatum, is usually a developmental defect. In severe cases, it can cause restriction on your lung capacity. And then you have hyperinflation, which is also known as the barrel chest. And basically, it's just the increased anterior posterior diameter, and especially when it starts to exceed the lateral diameter. And this is usually due to trapping condition like severe asthma or emphysema. And then you have the Harrison's sulcus, which is a depression of the lower ribs near the attachment of the diaphragm. And this is usually due to severe asthma in childhood. And then you want to palpate. So palpation have two things. First, you want to feel the trachea position. So you sort of do this to the patient's throat, and you want to feel if there's any deviation, whether if it's in the middle. And so it can be either pulled away, pushed away from the lesion, pulled towards the lesion, or displaced by the medial sternal mass, things like lung cancer, lymphoma, retrosternal goiter. And for the chest expansion, you want to put your hand in the back, and you want the patient to fully inhale and exhale. Basically, you want about 5 centimeters of expansion, which is normal. Right, and you can have symmetrical bilateral decrease due to asthma and emphysema, or unilateral decrease due to consolidation, like pneumonia, pneumothorax, localized collapse, or pleural effusion. And then you want to percuss. So when you're percussing, you want to put your distal interpharyngeal joint onto the place you're going to percuss, and then you're just going to percuss like this firmly, okay? So, and there are 4 kinds of sounds: resonant, hyperresonant, dull, and stony dull. So resonant means you're normal, hyperresonant, usually pneumothorax, dull, pulmonary consolidation, collapse, severe pulmonary fibrosis, and or stony dull, that's pleural effusion, and hemothorax, which is accumulation of blood in your pleural cavity. And then you have the auscultation, and basically you want to auscultate the same part that you percuss. So basically at your clavicle over here in the medial clavicular line, and then 3 spots until your 6th rib, and on the lateral side you want to go down to your 8th rib, and on the back you want to auscultate 4 spots starting from the very top of the apex, and then you want to go down 4 spots until the 11th rib. And basically, if you hear a sound, something we call a vesicular sound, and other sound can be things like crepitation, can be things like wheezing, hoarseness, etc. Alright, so that's pretty much everything I know about the respiratory examination at a 2nd year level. And if you have any more questions about these, feel free to just ask me in the comment section below, and don't forget to hit the like button and subscribe to the channel, and I'll see you next time. Bye!